While addressing journalists at the Ministry of Health, the Director General of Health Services, Dr. Henry Mwebesa, urged owners of private schools and head teachers of government-aided schools to report cases of COVID-19 discovered in schools.
As of 18th May, that's about a week ago, a total of 29 schools from 17 districts have recorded a total of 803 cases and 1 death. That's in schools.
The affected schools with cases of COVID-19 are situated in 17 districts across the country.
The affected schools include 10 nursing schools, 11 secondary schools, 7 primary schools, 1 PTC, and 1 tertiary institution.
The main drivers of infections in schools have been linked to non-adherence to SOPs.
The main drivers of transmission in these schools are usually overcrowding and certainly non-adherence to SOPs and inadequate supervision by the learners.
All proprietors of private schools and head teachers of government-aided schools have been urged to desist from the habit of concealing information of infections in their respective schools.
Schools are not keen at reporting because they think if they report and we go and investigate, we shall close them. That's not really our objective. Our objective is to go and investigate and help them and see, isolate those who are sick, treat them, and those who are not sick are allowed to continue. So we want to encourage schools, if they have any cases, symptoms, to report to us.
According to the Ministry of Education, districts that have recorded cases of infections include Kampala, Wakiso, Moroto, Amuru, Arua, Mbale, Masaka and Kalungu. Districts that have a low uptake of vaccination will have their vaccines withdrawn and redistributed to avoid them expiring.
The vaccines are due to expire on 10th July, as I have already told you, 10th July 2021. To avoid such a catastrophe, it's extremely important that we withdraw these vaccines and use them in the districts which need them and which are ready to utilize them.
Aaron Mukama, NTV.